are getting a whole lot of numbers thrown at us right now during this COVID-19 outbreak.
Governor says up to 80% of Minnesotans could get COVID-19, which seemed like a really bold statement considering the number of confirmed cases is 262.
Right.
So we wanted to know what the numbers tell us, what they don't tell us. Can you start, Heather, by explaining when we have this number of confirmed cases, does that include like a case that was diagnosed over the phone, or is that only like a confirmed laboratory tested case?
It's a confirmed laboratory tested case if it's been tested in the public health department. So that number, and the health officials, the state health officials will tell you that that number is not representative of all of how many cases are actually here in Minnesota. They say that you should assume that COVID-19 is in your community.
Yeah. So how do they know that? How can they make that statement?
Exactly. That's sort of what I was wondering. And how many cases do they think that we really have? There's a couple of ways they know that. We already know that there are people who are getting COVID-19 and they have no idea how they got the virus. So we know it's spreading in the community. What they also know is that there has been a jump in hospitals and doctors' offices of people coming in with flu-like symptoms, but at the same time, they haven't seen that jump in flu cases, so you'd have to assume it's COVID-19. They can also look at data from other places. For example, in China, some of the early cases when they had different kinds of testing, they found that the actual amount of cases was 10 times higher than what the testing was showing. Given here in Minnesota and across the United States with such limited testing, the Department of Health told me yesterday it could be anywhere of 10 to 100 times. So if you're on the higher end of 100 times, you're talking about 26,000 people in Minnesota that might have COVID-19. They expect it somewhere in between that 2,600 and 26,000.
Interesting. They do try to model this out. I think to a lot of us, it's so frustrating to not have enough testing. You think, man, like this has been going on around the world. If we had an idea as to where this thing was growing, if we could isolate people who were sick, you know, it seems like testing would really help us out a lot here.
Oh, you're preaching to the choir, and you can hear the frustration from the health officials about this too. Testing would make a huge difference here.
Yeah.
But
how do they model this out then if they don't have the real data?
It's fascinating. They are able to take a look at what's happening in other places and what this virus has already done. And there's some health experts over at the U of M School of Public Health that are helping them work on this. And what the governor has asked them to come up with in conjunction with the State Department of Health is when will we see our peak here in Minnesota? And what he really wants to know, and this is the key, is that when will we see the peak in ICU, intensive care unit capacity?
Sure.
They do anticipate that these numbers will come out. They've been working nonstop doing this, that these numbers will come out tomorrow or sometime over the weekend. But when we get that information, it's going to give us a lot more guidance on what to anticipate over the next couple of weeks.
Well, the reality is throughout Minnesota, there are only about, I don't know, somewhere between 1,100, 1,200 ICU beds, period.
Right.
Most of those in use right now. What the governor said yesterday, there are a couple hundred open beds right now.
Right.
So it doesn't take long to fill those up.
It doesn't. And if you have a little bit of a timeline, maybe you can add ICU beds somewhere else. What's been good about Minnesota is we have been a little bit behind some of these other states. We talked about last week how Minnesota was 8 days behind New York.
Yeah.
It's helpful for us because we can see what's happening in New York. We can use some of that data and some of that information to make assumptions here. We also kind of got ahead of it with the closing of the bars and the restaurants. This is according to the governor. So you can tell the things that we are doing, he says, are already making a difference, and you anticipate we'll see what happens over the next 2 weeks.
We have a couple things in our favor. We're not as dense, of course.
Absolutely.
We're way more spread out, less travel to the hot spots around the world, perhaps.